Good afternoon. My name is Bill Bierke, and I'm with Fallon Health. I am the Medicare sales representative, and I'm going to give you an overview. By a show of hands, is anyone a current Medicare member? Okay, so you're not a member. Okay, that's fine. The only reason I ask that question is sometimes it helps me keep in mind, the type of questions that might come up, and I want to make sure that I make it very clear as to what our program is all about. So I will treat the audience as if no one knows anything about Fallon. So the first thing I would like to add is that Fallon has been doing Medicare for over 40 years. We continue to do that into the future. We are changing the focus of our work, and we are actually eliminating some of the group plans that we've been working with in the past. So if your current employer does offer Fallon Health, that will be ending in the near future, and we're going to be an all Medicare company. We offered both Medicare and Medicaid levels of coverage, Medicare being the state level. People are familiar with Mass Health, and the Medicare is a federal program. Now, as you go along with me, I'm going to have you first do a couple of things. Just turn that first page, and it says Step 1, choose a network. So what this means is the folks that live in Worcester County are eligible for two different networks of doctors. So for people that have, for instance, Reliant Medical Group, you're eligible for both networks, but you can get lower pricing if you select the central network plans, and I'll review those prices in a little more detail in just one moment. Now, if you have UMass for your doctor as a primary care doctor, you cannot be in the central network. They do not accept the central plans that we're going to be talking about. So when you hear the term central, it means Worcester County, and if you hear the term broad, it means our statewide network of doctors and hospitals. Now it is an HMO plan, so you do get referrals from your primary care doctor. And if you want to flip to the next page, it says Step 2, I'd like to review the plan benefits with you. So in the first row, you see the central plan. So this is if you have a Reliant primary care doctor. You have 3 plan options. We tried to keep it simple, so we gave them names. We call them orange, green, and blue. So the orange plan has a 0 monthly premium. You just have to have parts A and B of Medicare to be eligible to enroll in the plan. And we also provide a $1,000 benefit bank, and I'll review the benefit bank on one of the next page or two. So the green plan has a $35 per month premium and $500 for the benefit bank. And the blue plan has $130 for a monthly premium with a $250 benefit bank. Now, the reason there's different dollar amounts in each of those categories, for us to be competitive, we had to look at ways of attracting people into the zero cost plan. All of our competitors have a zero cost plan, and they offer a lot of different goodies that go along with that. So we're introducing for 2022 what we call our OTC, over-the-counter benefit. And each quarter you'll be able to have $25, that's $100 a year, to use for over-the-counter items. And these will include things like first aid, vitamins, cold remedies, some things that you would normally have to pay for at a local pharmacy. Now, the way that program will work is you can either go online to the company that's coordinating that for us, or you can make a phone call and they will mail out the products you're selecting directly to your home at no charge. The next row is the Plus plan. So this would be for people that have UMass doctors or other doctors in the area. And the monthly premiums are 0 for the orange plan, $121 for the green, and $225 in the blue plan. Now, only the orange plan has the over-the-counter benefit. And I'd also like to point out that the St. Vincent's Physician Services, which is here in the Greater Worcester and Shrewsbury area, are part of the central network. So if your doctor's with St. Vincent's or Reliant or up towards Gardner with the Hayward Hospital, those are all physicians that would accept the central plan. What I usually suggest to people is go onto our website, which is fallonhealth.org. And we have a Find a Doctor tool. Look up the doctor and see if he accepts the central plan, or he may accept both of the plans. That's up to you. There are many people that have specialists that are with UMass, but they may have a Reliant doctor. Those people should select the broad network plan, not central, so that they will have no difficulty in getting to those doctors that they see as specialists outside of their Reliant care. Now, as you look at the next line, it says annual medical deductibles, all plans. There is no deductible that you have to meet before your medical care takes place. So you have first dollar coverage for everything medical. Now, the annual physical is covered in full on all of our plans, and one of the benefit changes we made this year, again for the zero cost plan as a competitive move, is to reduce the office visit copayment on our Orange plan to zero. Currently in 2021, that rate is $10 to see a doctor. We're going to make that zero starting next year. And there's a $45 charge for specialist care. And you do get your referrals through your primary care in order to have those particular services provided. We also offer telehealth services. There's no cost for that, for routine primary care type visits if you can't reach your doctor, and also for behavioral health. There is a copayment, however, if it's a specialist that you're trying to reach, because they will, in all likelihood, either end up writing some prescriptions for you or some other care that might be required. And because they are a specialist, they are in a different category of the telehealth program. Now, next on the chart is the ambulance services. If you're transported by an ambulance, you're going to be billed a copayment of $317. Now, if you're able to be transferred by a chair van from a hospital to a nursing home or nursing home to a hospital, depending on the situation, there's a $35 copayment for that service. It's known as a chair van. So it's horizontal ambulance. If you're upright, you can go in a chair van. The next is inpatient hospital care. The Orange plan has a $370 per day charge for hospitalization. If you go to the hospital and you're in for 2 days, it's going to be $740. If you're in for 5 or more days, the total is going to be $1,850. Now, people start to get nervous when they see the copays that keep adding up or multiple hospitalizations. The Orange plan has a maximum out of pocket of $7,550. So if you spend that much money, $7,550, you do not pay any additional copays or coinsurance for the remainder of the calendar year. Next is tests, procedures, and x-rays. They're covered in full on all of the plans with Fallon Health. You will, however, have to pay for things like CAT scans, MRIs, and some other nuclear studies. However, if you have those services while you're a patient, many people get diagnostic testing while they're in the hospital, you do not pay extra for those services. They're covered under your per day hospital charge. Next is outpatient surgery, and the best example of that would be something like cataract surgery. And on the Orange plan, it's a $350 charge. Again, keep in mind, as these dollar amounts add up, you've still got that maximum liability, that $7,550, that will, shut off at some point, and then you're going to have full coverage. We do cover worldwide emergencies. There's a $90 copayment. And if you go to a local walk-in urgent care facility, that is covered for a $10 copayment, and it's $90 any place in the world that you have urgent or emergency care. Now, the Silver Sneaker program is a gym membership that is covered locally and also nationally, because there are over 14,000 locations in the United States that accept the Silver Sneaker program. Now locally, the Shrewsbury Racket and Tennis Club is part of the Silver Sneaker program. So if you use that facility and also use the local Y, they are Silver Sneaker locations, and you'll want to consider that as part of your options if you're in our either green or our blue plans. So I'll review that in a little more detail later on. And the plans do include prescription drug coverage. So the green plan has a monthly premium that you do have to meet. It does have a little lower benefit bank, because the benefit bank does not need to be used for things like the dental services or for gym memberships. They are, and the benefit bank, as I said, is going to be discussed in just one moment. So the office visit copayment is $25 for the primary care doctor, $40 for the specialist. The hospitalization is covered at a $300 per day charge, so that's a maximum $1,500 if you do have the a 5-day hospital stay. And on the green plan, there's a $5,200 maximum out-of-pocket expense. So if you want to write at the bottom of your page $5,200, that's the liability that you have on the green plan. Again, no charges for the lab and the x-rays. The MRIs and CAT scans are a little less expensive on the green and the blue plans. The outpatient surgery is a little lower. The same benefit applies to the emergency room, $90 on the green plan. So we jump over to the blue plan, and on the blue plan, the costs are the lowest of all the plans. However, the office visit copayment is a $10 charge for your primary care doctor, $20 for the specialist. And the hospitalization is a flat rate, $200 per admission. So if you're in for 1 day or for 6 weeks, the cost for that hospitalization is only $200. And a maximum of twice per year would you be charged if you're a blue plan member for those particular services. Now, the other co-payments, as you can see down the list, do continue to be lower. And the maximum out-of-pocket on the blue plan is $3,400. We kind of ran out of lines when we printed the materials as to what's important and for people to know. And as I've been doing these presentations, people are concerned about that particular number on all 3 plans, you know, what would be their liability. Now, if you flip the page over, you see there are some additional benefits, and I'd like to talk about those briefly. Hearing aids are covered and available for everyone on the plan. They come in about 90 different categories, and there are 3 different price points that you can have for the plan. And there is a network of providers, and our customer service department can give you the names of the doctors, because they would also be the ones that order the devices for you. You're eligible for 1 hearing aid per ear per year. So they come with a 3-year warranty, and they come with 2 years of batteries and annual checkups to make sure that they're working effectively. The next is eyewear. The Fallon plans do cover a $150 allowance towards the purchase of eyewear. And you can utilize the benefit bank for any charges in excess of that. Now, the green and the blue plans that I reviewed briefly do have a dental benefit with a $25 copayment for cleaning and examination by the dentist. And there's a fee schedule for additional services that you pay directly to the dentist. There's no claims that go back to Fallon for any additional dental work. This is not a dental plan. It's a benefit within your basic coverages. Now, we do offer a program in addition to telehealth. It's called Care Connect, and it is a nurse that works with Fallon and available 24/7. They can advise you or maybe diagnose your symptoms and say, well, maybe you ought to get to the emergency room right away, or maybe if you just wait and contact the doctor, it doesn't sound like anything serious is going on right now. So they'll evaluate your medical situation. And all plans that are green and blue have the Silver Sneaker program, which I've just mentioned, and also Weight Watchers. Now, if you turn the book to the next page, this is the benefit bank. This was introduced last year, and this is a dollar amount that applies to all of our plans. And for people that are current Fallon members, if you had the broad network, we have doubled the amount of money that was on that card. It's a MasterCard that is preloaded with money that you can use for dental services at any dentist. There's no network restrictions as long as the dentist will accept a credit card, and it is not a Fallon benefit. We've had a few reports that the dentist says, I don't take Fallon. He's not taking Fallon. He's taking a MasterCard from you that has money on it. So the orange plan will have $1,000 next year. The green plan will have $500, and the blue plan $250. Now, in addition to the dental services, you can use any overcharges that you have on the eyeglasses. You can join any health club that you want. So, we watch TV and see, Planet Fitness, $10 a month. So you can use that $10 a month to do that, if you choose to do that. And finally, the hearing aids. If you have a need for hearing aids and you still have money on your benefit bank card, you could utilize that money to help pay for the hearing aids. So if you were to get the best hearing aid we offer at $995, and you didn't need glasses, you didn't need to go to the dentist, health club was out of the question, you've got $1,000. So you're basically getting one hearing aid free if you choose to use your benefit bank that way. If you're a green member, you're going to have $500 to use, and if it's a blue plan, then you have the $250. Now, I'm going to next talk to you about, yes?
If you don't use the benefit bank dollars in a single year, do they roll over?
The dollars do not roll over. They expire on December 31st, and we reload that benefit bank card on January 1st. Now, if you lose the card, you just call customer service, we'll replace it. And if you want to know how much of a balance you have on the card, customer service can provide you with the same day report on what your expenses are. So if you went to a dentist and you spent some money, but you got home and you forgot how much it was, and you have another need to use your benefit bank card, call customer service. It's a live, active card that we can give you same day balance of what's on that card. Now, under the prescription drugs, which is the white sheet that I gave you, two-sided, the first thing I want to have you look at is the page where it has a bunch of rates. So the rates are listed there, as well as those out-of-pocket maximums I mentioned. And at the bottom of the page, there's some information that you need to pay attention to. There are deductibles on the prescription drug plans for the orange and the green plans. So if you look down in the boxes at the very bottom of the page, before you're eligible to receive brand name medications on the orange and green plans, you will have either a $200 or a $300 deductible that has to be met. So we've negotiated to really good prices with the different pharmacies, and you will be charged, some very low prices on taking advantage of our purchasing power to get the deductible amount out of the way. And after the deductible has been met on those two plans, $200 on the orange and $300 on the green, then you will be eligible for the copayments. So if you flip the sheet over, you can see what the schedule of those payments will be. Now, the blue plan has no deductible for prescription drugs, so they immediately start paying the copayments you see listed here. And one other thing that we've also changed for this coming year is that we have a single network that you can choose from for all of your drugs. Before, there were two networks. There was a standard network and there was a preferred network. Now it's all priced as a preferred network. So if you had previously used, for instance, the Walgreens pharmacy, you paid $5 more than those people that were using the CVS pharmacy. So it's all the same pricing. It's all been dropped down to that lower preferred level. And another change, if any of you are current Fallon members and you're utilizing a mail order program, we are switching from Caremark over to a company called Optum RX. That's OPTUM RX. They are a nationally recognized pharmacy benefit manager, and they will be providing the prescription drugs by mail order. Now, if you use mail order, you will save 1 month's cost of copayment. So if you're in a tier 3 medication, which is currently $37, and you get it by mail order, you'll pay $74 and save $37 on that particular prescription. Now, I'd like to point out that the tier 6 includes the Shingrix vaccination. So if anyone that joins the plan has not yet had a Shingrix vaccination for shingles, it is available at no cost to you, as are flu vaccines and other vaccinations that you are, will be getting. Now, this page also shows you some cost figures that are called the coverage gap. Medicare has a standard rule across all insurance companies, so this same policy will apply regardless of which insurance company you are previewing. Once your costs reach $4,430, this is just below the graph that's in the middle of the page, and this is the cost that both you and Fallon have paid, then you are in the coverage gap, and many people also know that as the donut hole. During the next $3,000 or so of expenses, you're going to pay 25% of the drugs. So you might have been paying 0 if it was a tier 1. You might have paid 7 if it was a tier 2. You might have paid $37 if it was a tier 3. Now you're going to pay 25% of the cost of that medication. So if it's a $100 medication, you're going to pay $25 instead of that copayment that was under the schedule. And that will continue until your dollar amount that Fallon and you have paid $7,050, you're out of the coverage gap. And you're now what they call in the catastrophic stage, and your cost will shift over to 5% of the cost of that medication, or $3.95 for generic and brand names. It's all in the bottom of that page. So there are many people that never even come close to the coverage gap. There are other people that hit it in the first couple of months of the year because of the type of medication that they're taking. There are some very costly medications. Now, what I usually tell people that have those expensive medications is the Commonwealth of Massachusetts offers a program through Mass Health that's called Prescription Advantage. And if you speak to your local Shine counselor at the senior center, they can help you with the application, or you can go online and look it up yourself at prescriptionadvantage.com. It's a Massachusetts program, and it's for people that have income under combined $80,000 per year. So there are many people that are in that $50,000, $60,000 a year that might be a result of either pensions or Social Security combined, that they're up, but they've got really high drug costs. There's 4 different price categories with earnings that will qualify you for discounts on the through the Prescription Advantage program. And for people that receive extra help from Medicare, the extra help usually eliminates the deductible and has very low copayments as well. So those are some other things to take a look at. And again, those are income-based. So that's basically the overview of the plan itself, prescription drugs, medical. To enroll, you can either do it over a telephone, you can call Fallon Health. The phone numbers are on the back of the handout that I gave you. You can go to our website, you have a link to be able to enroll online. You can go through Medicare.gov and enroll. or you can fill out a paper application, and I do have booklets for people that are not currently enrolled with Fallon that you can take, and there's a summary of benefit in there and a little more detail from what we did during today's presentation. So does anyone, now you do have to, remember you have to have Parts A and B of Medicare, so if you're getting ready to turn 65, you're not there yet, 3 months before you're turning 65, contact Social Security and sign up for Part B of Medicare. The current rate for Part B for 2021 is $148.50 a month. It comes out of Social Security. If you're not collecting Social Security, they will bill you quarterly, so it's almost a $500 requirement that you'll have. And you'll have to continue to pay your Part B premiums in order to be a participant in the Medicare program. Now, there are many times during the year when you can change your insurance. Right now is the open enrollment from October 15th to December 7th. For people that have the Advantage type plans, which is what we've been talking about today, you have another open enrollment that runs from January 1st through March 31st. It's called the Medicare Advantage open enrollment period. And you can change within the company you have. You can go back to original Medicare. You can buy a Medicare Supplement, or you can change the companies that you have for your insurance during that period. And it becomes effective on the first of the month after you do the application. So if you decide at the end of January you're really in the wrong plan or you want to do something different, if you do the application before the end of January, it takes effect on February 1. If you do it during February, it's March 1, and if you do it anytime during March, it's April 1. So just keep that in mind. If you move from one county to another, Medicare allows you to change insurance plans because your rates may change. They need to know where you are in terms of address. So you have what they call a special enrollment period. If you go into a nursing home or you go to jail, those are qualifying events. You come out of jail, you can change your health plans. There's so many different reasons why you can change plans. During the pandemic, Medicare has allowed people to make open enrollment period changes because they're unable to either participate in going to meetings like this, or they missed the open enrollment because they may have been in the hospital. There's a lot of different reasons. So always check with your Shine counselors, call Medicare, call the insurance plans that you're interested in looking at. Do I have a special enrollment period? So there are many. The other thing, if you are eligible and participating on either the Extra Help or Prescription Advantage, that's another special enrollment period opportunity. Once a year, they allow you to make one change in addition to whatever else you might have done. So are there any questions?
Yes. I beat you to it. Is there any changes in the Medicare supplemental plan?
The Medicare Supplement Plan is basically a program that Fallon also offers, and it basically comes in 3 different levels. There's a core plan, there's a Supplement 1A, which is, and I'll explain the difference between them in a second, and then there's a Supplement 1 plan. There are no changes in the benefit design of the Medicare Supplement plans. However, the Plan 1A did have a price reduction of some $20 or so. So most people are in the Supplement 1 plan.
What is the price now for the plan?
Well, the basic core plan is $138 per month for the Medicare Supplement. And the 1A is priced at about $160. And the Plan 1, which has no deductibles at all, is $229. Now, for people that are brand new into Medicare, you're eligible, and it's all based on the Part B date, are eligible for a 15% discount. So there are people that have been working who might be 70 or 75 years old that then get into Medicare, sign up for Part B, and they are eligible for the discount. So now the core plan that we offer has 2 deductibles. You have to pay $14.84 if you go admitted to a hospital. It's called the Part A deductible. And there's a medical deductible of $203. The 1A plan removes the hospital deductible but does require the Part B deductible. And the supplement number 1 plan, the best one we offer, does not have any deductibles at all. So Medicare is primary on all 3 plans. They pay the 80%, and then if you have a deductible, you have to pay it. If you don't, then Fallon will pick up the full 20% on all other expenses. It does include the Silver Sneaker program, and it includes a $150 allowance for the eyeglasses and the Nurse Connect for getting assistance. Once you're enrolled in the Medicare Supplement plan, you're allowed to move out of state. It is portable because it's a Medicare. It means in the United States you can have coverage on the Medicare Supplement. Whereas on the Advantage plan that we first reviewed, you must maintain residence in Massachusetts. If you leave the state and move to another state, Medicare allows you 2 months to change the coverage. So if you have, we have a lot of people that are moving back to New England to be with families who may have been in Florida or someplace else. They have a special enrollment period, so they can change immediately because they're moving back into the state. That relocation gives them a special enrollment period.
Oh, I didn't know that.
So,
That you could do that. I've been on Medicare supplemental for a few years.
if they're on the Advantage, they can't, but if they are in the supplement, they can.
Yeah,
Yes.
but I didn't know that I could move out of the state or you couldn't.
Yeah.
move out of
Within the past year and a half or 2, that has become a decision has been made that we really could not drop you because Medicare is nationwide. So you would be able to change your residence and continue to be a Fallon supplement member.
Now, they still haven't taken away Silver Sneakers.
No, Silver Sneakers
They
continues.
haven't taken away eyeglasses.
No, that continues to be benefits on the supplemental plan. So if there's no other questions, I thank you for coming today. This concludes the presentation. And, call our, if you're a current member, you can get more information either from customer service, or if you're interested in getting more information, you can call our sales line, which is 1-888-377-1980. The phone number's on the back of the brochure that we used as a talking tool. And I thank you for coming today. Thank you very much.